exercises, and even life. Medics are the experts on wounds. Naturally, they are the best to simulate them for training.
See, that's why whenever...
Moulage is the art of applying mock injuries for the purpose of training. It dates back to the Renaissance period when wax wounds were first used for training doctors in the French army. Medics have become FX experts. Some of the wounds are almost too gory, too real, making wounds as realistic as possible, making the training as valuable as possible.
So the fragmentation wound that I'm doing right now is actually going to be an active bleeder. So what we do is we put a tube into it and have it actually bleed out. So we'll have a syringe with it full of blood. So when the casualty's out there, they'll have that hidden in their pocket and they'll start to squeeze it so it'll actually be bleeding as they're out there. So it's something that the TCCCers are going to have to react to, and they're going to have to stop the bleeding, whether they use the quick clot, which we have, which cauterizes the wound, or they're going to put a tourniquet on it and then a dressing over top, or else the patient obviously will bleed out, and we don't want that.
For burns, you have to do small pieces about the size of a toonie individually. It just adds to a better effect than just slapping a big chunk of wax on. You just get better, it looks more like blistering, and you get a nice burn pattern going on the skin. I can usually do this in about half an hour, 40 minutes, if I'm going to do her whole face and everything.